Welcome, everybody. Welcome to our Zoom participants, to our panelists. On behalf of the Newark Public Library Board of Trustees and the Newark Public Library Foundation Board, to this conversation on Philip Roth's novel, Nemesis, in the context of COVID-19. I am Rosemary Steinbaum. I'm a member of the Newark Public Library Board of Trustees, and I am the chair of the Newark Public Library Foundation. We have more than 200 participants from countries around the world gathered for this program. Thank you very much to the library staff who have worked so hard putting together this program. To Tom Allroots, our interim library director, Kirsten Giardi, Nadine Sergeyev, Ingrid Betancourt, and Diego Quintero. Praise today goes out to our great city of Newark, which has been a beacon of peaceful protest, and to our mayor, Ras Baraka, for providing powerful, thoughtful leadership in this extremely complex moment. The Roth Library, which is scheduled to open as a physical space in the next year at the Newark Public Library, has been open for programming for quite a while, with an annual Philip Roth lecture each fall on topics of American literature and American history, and with many virtual programs, such as the one we're participating in today. The Newark Public Library has been producing an astounding array of virtual programming at this time, when many of us feel that we are so hampered in what we are able to do. The Newark Public Library has been doing much, much more, reaching tens of thousands of viewers for virtual services and virtual programming. Story times, bedtime story times, Spanish story times, genealogy, African-American genealogy, counseling, census assistance, virtual LGBTQ drop-ins, and American Sign Language classes. The panelists and the moderator are ready to engage in robust conversation about Nemesis and the current pandemic. Toward the end of the hour, they will be able to respond to a few questions from participants. Please, if you have questions during the conversation, write them in the Q&A using the Q&A function at the bottom of your Zoom screen. I'll come back on and moderate the questions at the end of the hour, toward the end of the hour. This public session is being recorded, and it will be available tomorrow on the Newark Public Library website. And now, our moderator, Samuel Freedman. Sam is the author of 7 important nonfiction books. He's a journalist, and he's a journalism professor at the Columbia Journalism School. Let me turn it over to you, Sam. Thank you.
Rosemary, thanks so much for inviting me to moderate this extremely important panel. And thanks to Tom Allroots and everyone on your team at the Newark Public Library. Though I'm coming to you from my office at Columbia University, not only am I an ardent reader of Philip Roth's work, but I'm a native New Jerseyan as well. So this is an especially meaningful event for me. And I'll introduce our panelists in a moment, but also let me quickly introduce the subject of our conversation, Philip Roth's novel, Nemesis. I assume most of our listeners and viewers are familiar with it, but in case not, this was Philip Roth's last novel, the capstone of his extraordinary literary career. And it's typical of what he did in so many of his novels, which was to draw on history and on lived life within Newark, and particularly the Weequahic neighborhood where he grew up, and filter reality through his fiction writer's brilliant imagination. And in this case, what he did is take some of the realities of the polio epidemic that hit Newark particularly badly in 1952, life on the playgrounds of Newark and the summer camps that some fortunate families got to outside of Newark over the summer and reimagine it as a polio epidemic occurring during World War II. Great literature tells us the news before the news happens. And in looking at the past, Roth, as so often is the case, foretold the future. He foretold the COVID pandemic and many of its both medical and psychological and social effects. So to talk about all of that, we have a wonderful, wonderful panel with us today. First, and these are all co-equal, there's no meaning to the order here, Dr. Ben Martin is a physician at the University of Virginia and also has his undergraduate degree in creative writing from Middlebury, and just recently had a wonderful essay about, as a medical practitioner, what he took away from rereading Nemesis. Sheldon Bross is an attorney, a native of Newark, though he didn't grow up in Weequahic. He went to Weequahic High School, and he was living in Newark during the period of the epidemic in the early 1950s, and has both firsthand recollection of many of the places Roth writes about so indelibly, but also lived to see the damage, the death, and disability left in the wake of that polio outbreak in the early 1950s. Dr. Robert Johnson is the dean of the Rutgers, New Jersey Medical School in Newark, and also with Robert Wood Johnson Health Institute. And he is a lifelong Newark resident as well, and works in an array of public health issues that coincide with the COVID pandemic. And finally, Dr. Leslie Kantor, who's the chair of the Department of Urban Global Public Health at the Rutgers Global Health Institute. And she brings particularly a global perspective to us on what's absolutely a global pandemic. That's the meaning, in case you didn't know, of a pandemic versus an epidemic, that it's sweeping the whole world, not just one nation or one portion of a nation. So what we've agreed to do is to first have each of our panelists give briefly some of their top line thoughts about Roth's novel and how it speaks to the present. Then we're going to do a second round through the panelists in which we've asked each of them to either read a passage of the book or paraphrase about a passage that really keenly spoke to them. And then we're going to go through several more rounds of conversation before having time, as Rosemary said, for your questions towards the end. So let me reverse the order in which I did the introductions and start with you, Dr. Kantor, your overall thoughts about the book.
Sure. Thank you, everybody, for being on. And this is just a very illustrious set of panelists. And two people have actually written essays about the intersection of the COVID epidemic and this book. So let me, by way of frame, say that, we are sitting here in the United States the day after the largest number of new cases that we've had in the epidemic thus far. So the global perspective on that is that the United States now has the dubious distinction of having the worst epidemic of any developed country in the world. Just to give a little bit of contrast, polio at its height between 1951 and 1954 in this country, there were an average of just over 16,000 cases per year and about 2,000 deaths. And I think everybody is probably well aware that we've had almost 120,000 deaths in the United States alone since March. So we have an incredible epidemic going on here. I think what's amazing, though, about the book is that the experience that the characters were having, the feelings that they had about it, the being unclear about exactly how it is transmitted and how easily, that's exactly the point in time that we're at now. And this very frightening question of, could I be carrying it and passing it, or could somebody else be? This time of fear and suspicion when the science is still in process. It's actually amazing how much that resonates. And I think the only other thing I would say by way of my introductory comments are that I think we'd all love to have a national leader right now who is a lot more like Bucky Kantor, who was more interested in keeping people safe and protecting and reassuring. And unfortunately, we've got just the opposite.
And we'll get to Dr. Johnson next, but let me just put in a footnote. If you don't know, Bucky Kantor is the main character in the book. He's a playground director who's a hero to the young kids on his playground and is trying to give them security and confidence and a lot of public health common sense during this summer when polio is starting to rage across Newark. Dr. Johnson?
Well, good afternoon, everyone, and thank you also for including me in this panel. I am a big Philip Roth fan and read everything, just about everything he's written. I read Nemesis quite a while ago, and until I was invited to be on the panel, I didn't begin to make the connections. By way of introduction, I'll let you know that not only am I the dean of the medical school, I practice medicine in the city of Newark and have done so for more than 40 years. I still continue to practice medicine. And I take care of, I'm a pediatrician. My focus is both teenagers and young adults. And one of the things that strikes me after rereading the book is how it speaks to something that's really unique in the United States. In the modern era, we've had a number of times when there have been either pandemics or epidemics that have captured the attention of the public. The Spanish flu, more recently Ebola and SARS and a number of others. But there have been very few that have actually changed society. The Spanish flu changed society and we began to act differently. Most of us don't remember that. But HIV changed society. There was an overwhelming fear of getting it, and there were things the public had to do, and we began to act differently afterward, and it continued. Polio did the same thing, and I clearly remember as a child, I was in South Carolina at the time, we couldn't go swimming in July because of the fear of getting polio. And that sort of sticks in my mind now. I won't go in the water in that month because of the fear of getting polio. And I, as a child, was in one of the first groups of individuals that received the vaccine. In this particular epidemic, we had a change in society that's different than it's ever been before, where for 3 to 4 months, the whole world stopped. And that not only was effective in controlling, it's a good public health measure to control the pandemic in this area, but it also had some other consequences that we may get a chance to talk about later on. But some of those themes flow through the book too, because Roth not only talked about the infection, but how it affected everyone living there. And that was one of the genius of this author, that he does that and in a very short period of time engages you in a picture or a deep understanding of a whole group of society, their history, their current livelihood, as well as what may happen in the future.
Sheldon Bross, bring to this book your own experience as a Newarker. Sheldon, I think you're muted. You have to unmute.
I'm looking.
You're good. We're hearing you now.
Can you hear me now? Yes? Okay. Well, having gone to Weequahic, I'm familiar with a lot of the places, and as in most of Philip Roth's novels, a lot of the places are real places. The streets, the people, even Bucky was a real person who was the playground teacher at Chancellor Avenue Playground and was well known to everybody. So although his life did not follow the pattern as put forth in the book, but he was a real person. But just as far as the novel itself is concerned, I was very struck at the end of the guilt that Bucky felt, tremendous guilt that he felt. And I have 2 sons, both in their 50s, who are obsessed with making sure that during this current epidemic, my wife and I don't do anything foolish. And every day they check in to make sure we're doing what we're supposed to do, what Dr. Fauci tells us to do. and wear a mask, do we and do we not? And both of my sons don't want to feel guilty as not having raised their parents the right way and taught them how to behave during this epidemic. So I identified very strongly with that aspect of the book. And having lived through the epidemic, I remember not being able to go to Olympic Park swimming pool. For some reason, swimming pools became the main cause of polio to parents. And I remember I knew a young woman who died from polio during the epidemic in 1949.
And Dr. Martin?
Unmute myself there. You know, I have a really personal relationship with the novel Nemesis, and I first read it when I was a fourth-year medical student. I was still getting used to what it was like to take care of very sick people and dying people, and so I read Nemesis in conjunction with the other 3 novels by Roth that he kind of clustered in the Nemesis, these short novels he wrote at the end of his life. And there's a lot of meditation on these huge existential topics of death and dying, and all of that was very abstract at the time. And then when COVID broke out years later, I'm now an attending physician at a big academic hospital. All of a sudden, these existential questions that felt at once, you know, used to feel very abstract are now very immediate and very real. And so I turned back to Nemesis specifically because one of the central themes, of course, is Bucky's guilt, as you mentioned, and his specifically guilt about being an asymptomatic carrier, which was a very real fear of myself and a lot of my coworkers that linked me to the novel.
Thank you all. Now I want to go one more round. We'll do it in the same order of each of you pulling out from the fabric of this book a passage that really spoke to you. And I think this is very important to do because Roth has a great social vision. That's part of his, you know, magisterial skills as a novelist, but he's also just sentence to sentence, paragraph to paragraph, a superb user of language. And maybe this will give some of our viewers and listeners a chance to luxuriate in some of Roth's language as well.
Great. I think that means I'm up. So here's my passage. It's page 153 on my Kindle. And then all at once, he was thinking of Herbie and Alan, who had died because they'd spent the summer in Newark, and of Sheila and Phyllis, kids almost the same age who were flourishing because they were spending the summer at Indian Hill. And then there were Jake and Dave fighting the Germans somewhere in France, while he was ensconced in this noisy funhouse of a summer camp with all these exuberant kids. He was struck by how lives diverge and by how powerless each of us is up against the force of circumstance. So I'm sure we'll be talking a lot more about the inequities in COVID, but for me, this really just spoke to that issue very beautifully.
By the way, also beautifully read. I believe Audible is headquartered in Newark.
It is.
I think there's another profession awaiting you. Dr. Johnson?
Well, I have to admit something. I actually listened to the Audible recording. And it's interesting, Audible recording is available in several languages too. And so you have to make sure you get the right one. I don't have a particular passage. I have 2 themes that are in the book. And they're sort of in the background, and they just struck out to me because it's something I really think about a lot. And that is how we communicate about the illness, and then how among each other and among people in the public, and then how we communicate as a health profession to people about it. And in those days, there were no cell phones, and I guess there were a few television shows, and no governor or president coming on television every night, but there was the Star Ledger. And so the Star Ledger was an entity that was looked at as an authority. Now, the Star Ledger is still here and has much bigger stories this time, but it was not the chief means of communication about the illness. The other thing is that there was lots of telephone usage, and people talked among each other about who died and how things went. It took a long time to figure out things. And so you might conclude that there was a less informed public because of these slower means of communication. and therefore at the level of government, you have a better ability to control things. So the health department in the city of Newark was looked to save everything by quarantining that area, and everyone easily accepted it. Now you come to today and you have a much more informed public because you have immediate communication through Twitter and Instagram and the news cycle and all of that. And so you might think that, well, that's better because the public knows everything about it. That gets to the other thing, and that is the authority of physicians particularly, because in this book, Bucky's girlfriend's father was a doctor, and Bucky went to him and asked him for the word of God, and he gave it, and he felt better. Same thing with the doctors in the clinic in upstate New York. So the lack of communication allowed the health authorities to have greater power, greater authority. Now, whenever I see a patient, they come to me and say, well, I've read everything that Dr. Google has written about COVID, and this is what I think I have, and I am not the authority anymore. And fortunately, I'm old enough not to have a big ego, so it doesn't bother me that much. But I fundamentally believe that the increased amount of knowledge people have is better, but the increased knowledge changes the way in which health authorities relate to individuals. That was the thing that really stuck out to me. I thought about what it would have been to be a healthcare provider in the 50s or late 40s as opposed to today.
Mr. Bross?
Well, like Dr. Johnson, I came away more with a theme than a specific passage. And I was struck by how little they knew about the cause as compared to how little we know now, although we seem to know something. Every day something else occurs. And as I mentioned previously, to the best of my knowledge, the only place I was prevented from going was to Olympic Park swimming pool. And movies were okay, libraries, every place else was okay. But for some reason, a swimming pool was a no-no, and you would prevent getting polio if you went to, if you did not go to a swimming pool. And today we keep hearing of things we should and should not do. And a lot of people don't believe it. And a lot of people just don't want to believe it. And once again, back then, there was so little knowledge of what to do. And that's the similarity that struck me.
And Dr. Martin, your passage for us?
Yeah, I did. As an English major undergrad, I couldn't help but choose a passage. As you mentioned, the language is just so incredible. And this is a passage, it's a couple sentences long, and it's one of the passages that I highlighted in the essay I wrote. It really spoke to me. And so this is Arnie Mesnikoff, childhood student of Bucky Kantor, later on in life, reflecting about Bucky and trying to make sense of the way Bucky views the world. He has to convert tragedy into guilt. He has to find a necessity for what happens. There is an epidemic and he needs a reason for it. He has to ask why? That it is pointless, contingent, preposterous, and tragic will not satisfy him. That it is a proliferating virus will not satisfy him. Instead, he looks desperately for a deeper cause, this martyr, this maniac of the why, and finds the why either in God or in himself, or mystically, mysteriously, in their dreadful joining together as the soul destroyer.
Yeah, that's one of the passages I also remember shivering as I read. So we had the advantage as moderator and panelists to chat some last week to prepare for today. And one thing, Dr. Johnson, that you spoke about at that time, and I hope you can now bring it out to our audience, is the congruence of the COVID pandemic and the resurgence of the Black Lives Matter movement in the wake of George Floyd and Breonna Taylor's murders. You felt that that was more, at one level it's pure coincidence, the days things happen or don't happen, but in a deeper way you felt that there was a real connection, a real conversation between these two social forces.
You know, history is actually told in retrospect. And we have now 3 or 4 months of experience, and we're actually in the middle of all of this, and the story is not yet told. So one of the things we talked about, the long-term consequences of polio. We don't know what the long-term consequences of COVID are at all. We don't really understand the infection yet. We don't have a real good treatment. We don't have a vaccine, and it's still developing, and we can't even predict how it's going to behave. And so that's one of the things to be aware of, that this is a part of a year, a part of this terrible year. Now, at the same time this is going on, and at the same time we've made a change in the way we live that's been extraordinary, and we continue to do that. All of a sudden, there is another example of Black lives not mattering. Now, Black lives haven't mattered for 400 years. You know, it didn't matter during slavery, didn't matter during Jim Crow. Police have been killing Black people for years. This time, however, it had a huge difference. Not only was there a massive outpouring from the minority community, but the non-minority community participated as well. And everybody was there suddenly saying, we need to change things. So you get the sense that there's a sea change in society that's all of a sudden happened over a 6-month period of time. That's really amazing. I suppose those things have happened before, but I've certainly not in my lifetime, how there have been things that occurred in one area, the medical area, and they had a huge social consequence, and it came so fast. So, you know, I don't think we know yet what the connections are, but they certainly were temporally related. Some people have looked at this and said, well, what it was the fact that people were quarantined or at home for a long time and had time to think and thought about these issues. Or it may have been really that people were just frustrated. I wrote a little piece about outrage, and I think people were outraged about having to stay at home, or in the medical community, they were outraged because we didn't have enough personal protective equipment. So it was outrage everywhere, and this is another outrage, and it all came together. But I think that the point is that it will be great to see a year from now when someone writes an essay, one of you guys writes an essay about this remarkable year and how these things have happened, and that we may have some great benefit as a result of this infection. That is a change in how we all relate to each other. You know, for this one remarkable thing, we're willing to take the statues down now. All of a sudden, before that, we would not get rid of the Confederate flag. We wouldn't take the statues down. Now, governors are saying, take down the statues. So it's really just remarkable. And it's a breath of fresh air. You know, so I'd like to, maybe we should do this a year from now. We can see if we could opine about how it actually happened.
Well, you know, I have a question I'm going to toss out to the other two doctors in a moment, but before getting to that, you know, what your comments now remind me of is that part of the congruence also is that just like the camera phone video, the cell phone video that we have, the killings that put the reality of police killings in front of people who in the past might not have wanted to believe it, made it irrefutable, has its parallel in a certain way with what the death toll and the illness toll of COVID and the disproportionate effect on Black and brown people and on poorer people has shown us. It's made it unavoidable that there are huge disparities in access to healthcare, in living conditions, and at the same time, what's been unmissable is when you look at who the essential workers are, riding public transit to the hospitals, you know, or the stores every day, riding their bikes to deliver groceries. Again, disproportionately Black, brown, many immigrant, the non-rich. So some of the same disparities were put right in front of those of us, you know, who were more affluent and could be more morally removed otherwise. And when you were talking about, Dr. Johnson, the overlay of what a public health crisis does to inform public response on other issues. I want to ask Dr. Kantor and Dr. Martin both if in that respect, we're also reminded now not so much of the polio epidemic, but of the AIDS epidemic, in the sense that as that disease just was cutting down mostly young people, initially many gays, then it got into, bisexual and straight people through various infectious chains. But first of all, it outed people who had been living covert gay lives, but it also, in this strange way, amazing way, became a huge force for the gay rights movement. And I wonder if that's something, I see you nodding, Dr. Kantor, why don't you take off and run with that to start?
Well, HIV, as Dr. Johnson said so well, I mean, it really did change the world in some really important ways. Part of that was there had to be so much advocacy to get drugs out there more quickly, to get pharmaceutical companies to behave responsibly. And I think in some ways we're facing a similar kind of a thing, that we have a federal government that's basically, I mean, I would say asleep at the wheel, but I think it's actually, driving murderously at the wheel. And so in fact, everything is happening either at the level of local leaders or even individuals in terms of trying to move this along. I mean, very interesting. I was reading a piece the other day quoting a lot of people from other countries saying, we're making our decisions here based on the science from the United States. It's only the United States that's not paying attention to the science coming out of the United States. So, so I think that we're actually in much more of an advocacy moment. And it feels very similar in certain ways. And I think that Dr. Martin, his essay, if I might say something from that, when he was talking about not, early on in COVID, not having PPE, not having tests. And that's why medical providers were sitting worried that they might actually already be infected and passing this on. I mean, that is incredible in the wealthiest country in the world, where we had at least 12 weeks to get ready. So this does feel very much like HIV in certain ways. I think we all thought that we had changed the systems enough that we would be building upon it, but I think we have a little bit of a different challenge this time around.
Dr. Martin, do you want to add on to that?
Yeah, I think both of those comments are excellent. And one thing very nice of you to mention the essay that got me thinking about the pandemic is that a lot of my coworkers and a lot of people, a lot of doctors across the country have been saying how this has pulled back the curtain or really revealed how drastically insufficient our public health measures are in this country and even preventive medicine. And so hearing about, providers not having enough PPE is something really startling. Hearing about patients who, don't have access to ventilators is really startling. But then I go back a year ago and I think about a patient who comes in with low blood counts. I end up diagnosing with a blood-borne cancer, who then ultimately ends up selling her house in order to pay for her first round of chemotherapy, simply because she falls into that insurance gap. And so as horrifying as everything is that is unfolding right now, it's also very much in line with what we've seen, at least since I started medical school, in terms of how our country cares for the most vulnerable, the most at risk.
Yeah.
Mr. Bross, I want to bring you in here on something I think you can speak to uniquely. One of the things that Roth really captures in the book, and that many of us are really feeling in the COVID pandemic, is the sense of where is infection coming from, who could be carrying it, could I be getting sick myself, which can lead to a certain sense of helplessness, anxiety. What do you recall about being a young person during that period of the late 40s and the early 50s when you lost to polio people you knew, I think, virtually on your own block? And how does that inform your understanding of what people are feeling during this pandemic?
Well, once again, the extent of my being warned about polio was don't go to the swimming pool in Olympic Park, okay? Nothing else was out of bounds as far as I remember. In the summer of 1949, my family rented a bungalow in Bradley Beach, New Jersey, which Philip Roth mentions in his book, and says that in order to avoid places like Olympic Park, swimming pool, people would go to the Jersey Shore. Primarily, the Weequahic people went to Bradley Beach, and that's where we went that summer. And we rented a bungalow, and next door to us was the Posner family. And Joan Posner at that time was about 16 years old. And Joan got sick one day, and now here we were away from Olympic Park in Bradley Beach, where it's healthier. Just got sick one day, and the next day she died. And it was just, I remember it being a shock to everybody, but I was, I guess, 11 or 12 at the time, so it didn't have as much of an impact as it did on the adults, but it sent one hell of a chill through all the families there. And as I said, I guess at 11 or 12, I'm not that conscious of surroundings. I did not know that FDR had polio, right, and could not walk on his own.
Well, a great effort was made to keep the public from
That's
knowing
right.
that.
That's right. But so I do remember that, and can identify very strongly with a lot of the things that are said in the book about that. And the streets are real, the locations are real, as I said in the book. So you do identify with it if you're from the area.
Dr. Johnson, you mentioned that in your own practice, you do young adult medicine, pediatrics, sort of into young adults. What kind of conversations have your patients or their parents had with you during the pandemic? What do they want to know, and what are you able to tell them? And what is there any, solace or optimism that can be offered, or is this a period when it falls on a doctor to be the bearer of news that's anywhere from incomplete to prospectively grim?
Well, it comes up a lot in my discussions with my patients, and you have an illness where the symptoms are pretty ubiquitous. You have body aches and pains, congestion, sneezing a little bit. At 73, I get up every morning and have body aches and pains, so it's not an unusual set of symptoms. And teenagers in particular are frequently take something they read and then they suddenly get the illness and translate to their bodies. Early on the epidemic, however, you remember that it was a disease of older people. And interestingly, my patients, this is before we were wearing masks, would come in and they'd say, well, I don't have to worry about that, but Dr. Johnson or Dr. Bob, I'm worried about you. And what are you going to do to protect yourself? You're going to still continue to work because you're 73 years old. So it was something that they were aware of, but that it was something for older people. Now, as we've gone forward, there still have not been many teenagers. There have been some young adults, and of course there is a severe post-infectious syndrome in children, but still that's quite rare. So it's not being seen as something you have to worry about. However, now that we are wearing masks, they've all easily adopted that. Interestingly, I think it's something that they love about doing that, and so that has not been a big problem. But I do want to say, if I could, I want to make one point about the discussion we were having earlier, and that is that we're in the most technologically advanced, medically technologically advanced country in the world, and we still were not prepared. But we should have been prepared. We should have been prepared because there was plenty of warning, and in the last 20 years, we recognized that these pathogens will come and they will have these major effects. And so there's an area called emerging pathogens. There's a Center for Emerging Pathogens at the New Jersey Medical School, and people in that area have called for greater preparedness, called for warning. The CDC has been prepared to do this, and Fauci was involved in it as well, and the scientists were not listened to. And one of the problems we're seeing now, unfortunately, is not only are the scientists not being listened to, they're being blamed. And we have the leader of the country who says that the problem is not the fact that people are getting sick or getting infection. The problem is we're doing too much testing. And so we should slow down the testing. It's a very dangerous viewpoint. And if you look at some of the rallies where people are just completely rejecting good public health measures and they're saying, no, it's not something I want to do. So it becomes like a political badge of honor not to do the things that the scientists have to do. Now, the other reason this is a big problem is that in less than a year, we'll have a vaccine. And we'll have the job of vaccinating 300 million people. But vaccination is another area where there's a strong anti-scientific theme in the public, and it's going to make it even harder. So I'd be interested to see what happens in the future.
I think you're quite right. I mean, historically speaking, even though there have been other examples of, as Michael Spector of the New Yorker calls it, denialism about science. You think of people who wouldn't, get fluoride treatments, so didn't want fluoride in their water. Or there's recently a piece about Southern agriculture interests who refused to accept the fact that pellagra was caused partly by a diet that was too based in corn. Overall, mid-century was a time when there was more trust in expertise, more trust in rationalism, including science. But one thing that Roth also gets, the other virus that he writes about, besides polio, is a virus of hate and demagoguery that also flows through the narrative of Nemesis. He talks about the fact that that in the Italian neighborhoods of Newark, a lot of people blame the Jews for somehow bringing in the virus. And in the Jewish neighborhoods, they're thinking this must be coming in when our African-American, cleaning ladies are coming in. They must be bringing it in. And so this illness that no one can trace becomes fertile ground for blaming an other, capital O other. The only difference is that it's happening at the grassroots level in Roth, but I wonder also what any of the panelists think about the risk to the social fabric when now you actually have the leader of the country using a racist, anti-Chinese or more broadly anti-Asian term to identify the virus and to conflate it with a particular identifiable ethnic or racial group.
Right. I mean, it's clear that the kind of violence that's happened against Asian folks all around this country it's amazing.
Yeah.
So, there's no question that racist rhetoric has real outcomes. I actually was interviewed for a story, and there have been several stories about this earlier this week, about death threats to local public health leaders. Mm-hmm. I mean, usually people don't even know who the local public health leaders are. And there have been more than 20 resignations from, very key posts. One of the death threats was against the Los Angeles County health officer. So the threats are not just staying in the red states. They're all over the country. Dealing with this as a political issue and the idea that a mask is somehow a symbol of liberalism rather than a health measure, again, it's just completely different than what's happened in any other country. In Iceland, rather than having politicians do that daily briefing that we're all used to, they had epidemiologists do it. And guess what? They dealt very nicely with their epidemic. You look at a leader like Jacinda Ardern in New Zealand, who's the elected leader, but dealt with it completely differently. And I think other than Bolsonaro in Brazil, I can't think of anybody else who is using this as just a way of dialing up more hate against certain people.
And by the way, unless I'm mistaken, there was a court ruling in Brazil, I think yesterday, saying that Bolsonaro has to wear a mask now in public.
Maybe we can get that for our president.
I know that we want to leave time for questions, and Rosemary, I'll give you a heads up. We'll go to that after one more, what we would call a lightning round or a speed dating round around the panelists. And we'll go Dr. Kantor, Dr. Johnson, Mr. Bross, Dr. Martin. This is just pure speculation and alt history. What do you think Philip Roth would be writing about our current moment, where he's still alive and still writing?
I told you so. What I'm amazed about is that he really saw some, I don't know whether to call it a strand, you know, in the United States, of this sort of almost pro-fascist orientation, and I sure didn't see it coming.
But he had a phrase of something like the all-American berserk, or the you know, Native American, not meaning indigenous people, but the, you know, native-born American berserk, something like that. Berserk was definitely part of it. So Dr. Johnson, what do you think Roth would be writing about now?
There you go. I think he would be reissuing his other book that involved that area, The Threat Against America, because that is frighteningly similar to what's going on now.
Mr. Bross?
Well, I agree, and it's actually The Plot Against America.
Plot Against America.
Plot Against America, and that's exactly the book that came into mind when you said that, because it's all about that, about blaming a group, one group. And I remember in the Pittsburgh massacre at that synagogue, the shooter there said it was the Jews who were promoting illegal immigration. And that was the theme there. And one after another, there's a repetition of this theme, blaming a group for it. And as you pointed out, the Chinese caused this one, and it comes from the top. And Philip Roth, writing about it, would probably Philip Roth would probably write a book about a president like Donald Trump.
Yeah.
He really would. It would be a perfect theme for him to write a book about.
Dr. Martin?
After having been in Charlottesville for the horrible neo-Nazi rally in 2017, I became interested in learning more about the way that internet subcultures fueled some of those tribes or groups of racists. And so I think Philip Roth would have been able to do a really great job of creating a very human and empathic figure within that movement. I would have loved to see him create a young man who is white and angry and misguided and gets sucked into this internet subculture, and maybe have him have a showdown with like a Bucky Kantor type.
It's a fascinating thought, you know, in Plot Against America, and also which had a terrific HBO adaptation recently, the Rabbi Lionel Bengelsdorf, who's a rabbi who thinks that he can kind of soften the fascistic edges of Charles Lindbergh, who's elected president, and of course ends up becoming victimized by that same fascism. It's an incredible, you know, portrayal of someone who's almost willfully self-deluding, and yet he comes off somehow oddly sympathetic. So I will turn it now over to the wonderful skilled hands of Rosemary Steinbaum, who's been sifting through the many questions that have come in, and we'll choose a couple that our panelists have time to address.
Thank you, Sam. I'm going to pass along two questions that came in. One is in the tone of a hypothesis. So I don't know that I'll be able to turn it into a question, but please take it as that, food for thought. Is it possible that because we all, or people in general, have such a feeling of helplessness in the context of the COVID epidemic, that we have adopted the anti-racist agenda as something we might be able to do something about?
I really like that idea, and just building on what Dr. Johnson had mentioned earlier about how information is so different, how easy it is to obtain a lot of real information like video footage in this day and age compared to back when Nemesis took place. Thinking about the video footage of these horrific killings in conjunction with some of the first footage that came out of New York City hospitals, where there was a physician who I believe subsequently lost her job, who took a camera through the ICU showing these just, I mean, it looked like something out of a nightmare, patients overflowing into the hallways. And so the idea of when we lack central leadership when we lack empathy in our central leadership, having all this information coming at us that's empowering in the sense where we can see things plainly for how they are, and therefore we're going to take things into our own hands. We're not going to stand for a lack of empathy. So I like that hypothesis from the questioner a lot, and I think these two social forces dovetail really meaningfully together.
Yeah, I'm really slow to adopt a hypothesis, and I think it's really too early. You know, as I think I said earlier, we really understand history in retrospect. And so, you know, we understand the history of the founding of the country 200 years later after historians have looked at it and written books about it. So to have an explanation for what's happening now, I think it's really too soon. I think that the thing that's important is that it's happening now, and that we need to make sure that this time there is a change. You know, I've lived through demonstrations with the civil rights movement as a child. I lived through the election of the first Black president, a number of things, and I lived through cross burnings when I was a kid in South Carolina, but things don't change enough. They get better and then get worse again. And so I think that the focus should not be on the why, but how can we make sure that we have a goal this time, and how can we move towards that goal?
Is the fact that coinciding with the virus, where most of us are home watching television, and we've seen that awful video 20 times, and I don't see how sitting there and looking at that video, most people just can't react to it the way most people did react to it. And I think that's the difference now. I don't think it has anything to do. I've resolved the virus because I know just stay home, behave myself, and there'll be a vaccine maybe 6 months or so. So that's how I've resolved it. I didn't have to resolve it with the other thing. But I do think that more of us have seen that video more times, and it's different than anything we've ever seen, and that's the difference.
I have two questions, and I think I'll end with them together. I'll ask them one at a time, but they're both specifically about the novel. Does anybody know, we have a question, what prompted Roth to write Nemesis?
I believe James Coetzee wrote a review of the novel in New York Review of Books when it first came out, and in that review he mentions that Roth had talked about reading The Plague by Camus around the time of writing the novel. And so after rereading Nemesis, I then went on to read The Plague for the first time, and partially just because of the topic, there are a lot of parallels, but there are these little gems that Roth drops throughout the novel that to me were a direct callback to The Plague. So I can't verify that as a fact, but that's something that I've read was a source of inspiration.
Ben, that is a really important thing to say, because as Roth's books are coming into the Newark Public Library, because we're forming the Roth Library, there are two copies of The Plague. One of them not particularly underlined, the other one heavily underlined with lots of highlighting. So some scholar may be able to pick up that insight and do something with it. Thank you very much. The other Nemesis question that came in is, and if whoever feels competent to answer this, where would you place Nemesis in the Roth pantheon in terms of writing and insight? Top 10, top 5? How do you see it?
If no one else will dare it, I'll jump in as moderator. I'd put it certainly in the top 10. At least for me, the American trilogy, as he calls it, so American Pastoral, I Married a Communist, and The Human Stain, are the apex. Plot Against America is high up there. The Counterlife for me would be up there. But of those series of very short novels that Dr. Martin mentioned that he's writing at the end of his life, these jewels, these brilliant miniatures, all of which are dealing with the great existential questions of disease and aging and death and the caprice of the universe, as Roth probably would have said, I think of those, Nemesis is the very best. I like Everyman a lot also, but I would lift up Nemesis out of those. And I would put it in the personal ranking for me somewhere in the top 6 or 7. And what a fun parlor game.
Anybody else want to venture an answer to that one? Thank you, Sam. I'll turn it back over to you.
Okay. Well, first of all, I want to thank our worldwide audience via the wonders of Zoom for joining us today. And again, to thank the Newark Public Library, Rosemary Steinbaum, Tom Allritz, who I'll turn it over to in a moment, for assembling this exceptional panel and these wonderful panelists. It's been oxygen to the brain to be in your presence. So again, Dr. Leslie Kantor, Dr. Robert Johnson, Mr. Sheldon Bross, Dr. Ben Martin, I give you applause on the screen. And now, with gratitude and thanks, I turn it over to Tom Allritz to close it out.
Okay, thanks to all of our panelists and our moderator today. And also thanks to Rosemary Steinbaum and my fellow staff members from the Newark Public Library who planned and executed this event today. Thanks to all of you for attending our Zoom event today. I hope that you enjoyed our presentation, learned a little more about the Philip Roth Personal Library at the Newark Public Library, and that you will join us in supporting the creation of the room as we enter our construction year. Please plan on joining us in about a year for the opening of the Philip Roth Personal Library at the Newark Public Library, and continue to participate in our Roth programs over the next year. So long for now. Hope to see you at the library soon, and enjoy the rest of your day. Thanks.